Hello, my name is Kathryn Grace. I'm a service design and innovation consultant. Innovate York have asked me to answer a few questions. I'm working on a project called HealthSpark, a shared digital conversation space for healthcare in York. It's for everyone, for both the public and for service providers. It's got 3 areas: a discover area, a discussion area and a solve area. So the discover area is a place to find out top level information, what people are talking about, what's most important, what is and isn't working, what's trending in terms of subjects that people are talking about. The discussion area is a place to have open conversations on any health issues. You can start a conversation, you can join a conversation, and you can just watch a conversation. The solve area is a place to find out and present projects that are solving particular healthcare problems. So it's a very fast-track way of showing top-level information on really interesting projects, whether big or small, in the city. HealthSpark's aim is to enable healthcare workers to become more informed and therefore effective in what they do, and for the people of York to get the healthcare services and information that they really need. The project came about from the Synergy Surgery Innovation Weekend for health and creative professionals held earlier in June this year. The event was a partnership between the City of York Council, Science City York and the Knowledge Transfer Network for Creative Industries. The project came about as the result of a design challenge at the Synergy Surgery Innovation Weekend, a kind of hack jam event to address health challenges in York. The design challenge we chose to respond to was just one of many challenges we could have chosen on the weekend that were crowdsourced online. Innovate York had set up the Genius platform to generate a list of health needs and challenges that we could work from. And the challenges came from the people of York, so we were responding on the weekend to real needs rather than just coming up with random ideas. Innovate York are part of Science City York, and together they created the opportunity for the project to happen and then have supported us to bring the project to life. They invited the people to attend the weekend. We had a great mixture of health and creative professionals on our team, and I don't know how I would have met that combination of people so quickly in another way. Over the weekend, Innovate York helped the groups develop their projects by providing inspiring talks on recent health innovations and bringing in creative facilitators to help each group progress ideas and give advice as needed. They were quite hard taskmasters, so it was quite a lot of fun. Our project won funding at the end of the weekend, which was a bit of a surprise, which is unlike other jam and hack events that you do. So this meant that the project could really happen. Innovate York very quickly followed us up after the weekend and helped us clarify who our team were going to be moving forward, and connected us with the health professionals in the city that would be good to talk to, and supported us to develop our business plans. Well, HealthSpark would never have happened without Innovate York. We'd never have started it for a start. They brought the challenges to the design weekend and brought the people together that could work on them, and Innovate York ensured our design work met a real need in the city. The value of this approach has really shown its value when our project won funding on the weekend from the City of York Council DIF Fund, and the Dragon's Den included people from the council and also people from the York Hospital. The interest for the project is increasing, and Innovate York keep introducing us to people, and the York Teaching Hospital NHS Foundation Trust, for example, they've said from a healthcare perspective they'd really like to see this project develop, and we'd love to work with them. Well, at a top level, the aspirations is for the project to affect the whole. It's an opportunity for the whole population of York to engage, both the public and the service providers. At a personal level, it would benefit someone who just found out they'd got an illness or they were worried about something, and they could find out about information about it, give them an opportunity to see what projects are going on around that illness, to see what conversations are going on, and to connect people with the right organisations for formal contact. But it just gives an opportunity for that first level of informal conversation in a discreet way. You don't have to go to a centre, and you can find out information really quickly. At a city level, the head of public health and top professionals in the city need a window on health for the city, and this project aims to provide that, just a one-stop place where you can see lots of activity in health all at the same time. And by bringing all of the different groups together, and we've already met Health Watch and the hospital and public health professionals and charities within the city, and they're all really excited about this, and we want it to be a shared conversation space that's going to enable all of the groups to talk. So it works, and also it works with the public, so that the public can feed in, so and can say what they think is important. So we're starting with an exploration stage, what we call a minimum viable product, trying out different approaches to conversation in the city, and as we get engagement, we'll develop this up into a product prototype. And if that develops, we'll develop it up stage by stage. So we're looking at digital in its widest sense, so it's web, mobile, on your tablet, wherever you are, and you might have public spaces where stuff is on display. The need for the NHS to collaborate with patients at a local level is rising, as seen in the new Citizens' Assembly model that's currently under discussion. And this the project Health Spark very much echoes with the aspirations for that. So we're definitely looking at a need that a lot of people are sharing across the UK. Funding initially has come from the DIF fund at City of York Council, but we're already looking at expanding that to include the NHS Foundation Trust, the York Teaching Hospital, and the CCG. And if this goes in the direction and is successful as we hope, we could be contacting NHS England for support as well. So, and I'd like to say a very big thank you to Innovate York and Science City York and City of York Council for kind of collaborating and bringing this project together. I'm really excited about it, as I've said, and as a team, Health Spark would like to say thank you very much for making it happen and enabling us to connect with the right people to get projects off the ground. Thank you.